Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thanks for joining us. Going to be talking with Dr. Kyle Kinmon, talking about turning to home exercise as a result of, the COVID-19 situation. Any situation that causes a person to, take care of their feet, their ankles, exercising at home as opposed to going out to a podiatrist. Well, he's in South Florida and he's talking about how patients can seek specialized treatment if they're uncomfortable going to the doctor's office in these times, what we can do about foot and ankle problems, and when to know when to seek out a specialist. Welcome to the program, Dr. Kyle Kinmon. Thank you for taking the time.
Well, thank you for having me.
Give us a brief background and tell us what it is that we need to do in these times to take care of our feet as best as we can.
Sure. I'm a board-certified podiatric surgeon specializing in general podiatry and foot and ankle surgery, and practice down here in South Florida. I represent certified foot and ankle specialists, which covers 3 counties down here: Broward, Palm Beach, and Martin counties. And we have 15 doctors, 9 locations. And basically, we have been seeing an uptick in patients with overuse injuries during these times with the increase in outdoor activity. Fortunately, we've had, which I think is much of the country can't say the same, but it has caused people to be out and increasing activity and causing some injuries from lack of experience. And so we think there might be an opportunity to help with that.
When you say lack of experience, we've been walking, running, hiking. We've been doing all the things that we were doing, up until several months ago on a regular, ongoing basis. What is it about being at home? What is it about our routine that is affecting our foot and ankle issues at this time?
Well, a couple of things. On the athletic side, what we're seeing is with the closure of the gyms and swimming pools and beaches, where people often get their aerobic activity on treadmills or elliptical trainers or stationary bicycles or swimming. Again, they're walking and running, and they're doing so much more frequently because it's the only thing they can do, right? And so anytime there's an increase in activity quickly and the muscles in the body aren't accustomed to that, then there can be overuse injury. And so I think that's what's leading to it on the exercise side. On the diabetic foot side, that's a different story. People are not getting out. They're afraid to go out, and they're not following up for routine visits with their primary doctors. And we've seen quite a few diabetic foot wounds develop from people being too sedentary and pressure sores, and combined with their blood sugar being out of control from not being able to go to the gym or follow up with their doctors properly, those are leading to issues as well.
From a foot and ankle specialist standpoint, what are people who were, as you say, sedentary before, but kind of rethinking their health options and things of that nature now, and now they're starting to do things that they didn't do before? Are they not seeking out proper advice about beginning an exercise regimen as it relates to the foot and ankle, trying to just go it on their own because they think they feel okay?
Yeah, definitely. It's that's even more pronounced than the people that were active before and have just sort of changed their activity. So the sedentary people, when they go out for walks, they, again, it's the only thing they have to do. They're doing it too much, and they're ending up with overuse injuries. Like examples are stress fractures or plantar fasciitis or tendonitis. We're seeing multiple cases of this every day in the office. And through telehealth, we're able to address these issues now through telehealth many times. And I'll tell you what really leads to it. The reason that these things are happening is from, number one, too much activity too soon, and also lack of stretching. Stretching is really key to preventing these injuries. And the third thing is just proper shoe gear and arch support. If people would do those things and kind of gradually build up to these distances that they're walking or running, I think they'd be much better off.
How much do foot and ankle issues contribute to back issues, especially when people are at home now, a lot of people working from home and dealing with their healthcare providers through telehealth rather than moving and going to the office.
Yeah, we lower back issues definitely play a part in all of this as well. The combination of going out and running or even walking too much, and then combined with sitting at a desk at home for a prolonged period of time, or even sitting in a car, can perform a syndrome and severe lower back strain. So we definitely see that as well. And again, the primary best way to prevent this is stretching. And so, one thing that people could be doing at home is a lot of the yoga studios are putting out free, live yoga webcasts. And we've been recommending that to patients. That's a great thing to do in combination with increasing these type of activities to sort of balance it out and stretch, and also to strengthen the core, which is important for lower back pain.
So the closings of the gyms, the swimming pools, the health clubs, are there things that you recommend at home when it comes to foot and ankle maintenance or issues that are good to mimic what you would do at a gym and do it safely?
Yeah, so in addition to, first and foremost, again, I just want to emphasize the importance of stretching aggressively or for an extended period of time, more than one would do under a normal course of activity. And they should do that prior to any type of at-home exercise. With being sedentary so much, we're all tightening up, and tight muscles, tight ligaments, tendons are the number one cause for these overuse injuries. So first, lots of stretching, make sure they have a good routine and protocol down for that. And then otherwise, it's just a matter of, walking, calisthenic type exercises that can be done with these live webinars that are being put out, I think are the most important things to do, and then building up gradually to the walks and runs.
So when is it time to say, hey, I need some help here and seek out a specialist because your issue is a lot more than you can deal with at home?
Well, I think that the first thing would be to, should any pain arise, definitely give it a rest. Stop doing the activity that led up to the symptoms, and then stretch, ice, and use anti-inflammatory medicine if tolerated and no contraindication. And work over 5 to 7 days. Then I would seek out a telehealth appointment with a foot and ankle specialist in the area as the next step. See if there's anything that they could identify remotely and treat remotely. And then give that, typically what I'm doing is giving that another 5 to 7 days. And if that's not solving the problem, then it's time to go in and be seen for some imaging. Stress fractures are something that are kind of hard to differentiate remotely. You really need an image to see that. Typically, they don't show up for a good 2 weeks on a plain film x-ray. So it's okay to give it a little bit of time at home, trying these things as long as you've stopped the activity that led up to the symptomatic problem to begin with.
We need to remind folks that especially doctors' offices are doing even more to protect patients and staff during these times. So don't be afraid to go into the doctor's office if you're having a legitimate problem due to the COVID-19 situation as it stands right now.
Absolutely. We are taking precautions, aggressive efforts at sanitizing surfaces. We're all wearing masks. We have spread the patient appointments so that there's no crowding or social distancing. Doctors put the patients alone without crowding from assistants or scribes. And patients are allowed to wait in the car should the waiting room become too crowded to accommodate 6-foot social distancing. And we'll text them when their room is ready. They come straight in and go in their private room. So I will say, fortunately, in our practice, with all of our locations, by doing this, we've not had any staff members or even patients that we know of infected with COVID. So we're really happy and keeping our fingers crossed on that.
Where can our listeners go and get some information about foot and ankle care, especially during these times, and some more about your practice as well?
Well, our website is certifiedfoot.com. So we have a lot of information and some good links on there. You also might want to Google the American College of Foot and Ankle Surgeons. There's a lot of good specific condition-related articles there, or the American Podiatric Medical Association website.
Great. Dr. Kinmon, thank you for joining us here on Health Professional Radio this morning.
Thank you so much. Be well.
You as well. You've been listening to Health Professional Radio.